will explore and discuss the newly developed ADHD Prescribing Guide for Australian healthcare professionals, its contributors, and highlight the key contents along with the rationale behind the recommendations. The guide aims to deepen prescribers' understanding, enhance confidence, and promote more consistent practices. Although focused on medication, it underscores the importance of combining non-medication strategies for optimal patient outcomes. I'd like to welcome Kate Tognarini. She is a community pharmacist and an AADPA board director. AADPA is the ADHD Professionals Association. Kate has experience in all areas of pharmacy, including hospital, industry, and community. With over 20 years in pharmacy, Kate specialises in mental health and neurodivergence, in particular all things ADHD. Also, as an AADPA board director, she's passionate about training and education in ADHD and fostering interprofessional collaboration. Welcome, Kate.
Hello. Now, I'm sure you can see me because I can't see you at the moment. So I'm just going to go through, and thank you so much for inviting me to present at this conference. I'm really excited to share with you this new resource which AADPA has just recently launched on the 1st of this month. Now, Rob, you've done the acknowledgement of country, and I would just like to mention that I'm coming from Melbourne, which is the Wurundjeri land. And I would also like to explain a little bit why a pharmacist like myself has contributed to a prescribing guide. So I would like to tell you just a little bit about my story of how I came to co-lead this with Dave Coghill, who is a well-known psychiatrist and world leader in this field. So a number of years ago, I was really surprised to be diagnosed with ADHD. It was me, it was other members of my family, and it was then that I really realized that as a pharmacist, I knew very little about ADHD. I was still working on that perception that it was a young boy bouncing around the place. I knew about the drugs, but nowhere near enough, which I know now. So I also saw that there was a general gap in the healthcare knowledge about ADHD and the medications and how they work and how can they be optimized. So I did what every person with ADHD possibly does and did a very deep dive into the condition. I also joined AADPA, which, as you said, is the Australasian ADHD Professionals Association. And there again, I was quite active on the communication channels because I was one of only a few pharmacists in the membership. So then when the opportunity came up to co-lead writing of the prescribing guide with Dave, I jumped at the chance. It was amazing. It was exactly what I wanted to achieve from my own experience. So I don't have very many slides. I'd rather just talk you through it because the actual guide is an extensive 150-page document. So there's no way I can do it justice just by showing a few pages. So I will give you almost like a storyline instead, and then some take-home messages. So my plan is to tell you how the prescribing guide came about, why we decided to do it, who it's for, and also who contributed to it, what kind of information is contained within it, the main takeaways, and I will finish off with where I hope this guide can take us. So I'm just going to leave these authors there so that you can have a look through the names that were involved. But the how of the slide is that the AADPA ADHD guideline was released 2 years ago. And that was a roadmap to the whole clinical practice of ADHD, very heavily evidence-based. And it was a top-level type of resource. It needed more practical details in various areas, and we decided to focus in on one of those sections, which was on medication. The why is that we needed specifics. We needed to bridge the gap between the high-level recommendations and the practical needs of the prescribers and also other healthcare professionals. So why did we focus on medication? Well, in Australia, we found that there is significant variability in prescribing. There is also inequality of access to treatment and diagnosis. The other thing is because some of the medications are stimulants and they're very highly controlled, they can be a little bit scary and daunting for people to get into the area to specialize. So we felt that increasing the information about this would lead to increased knowledge, so increased understanding, and then filter through to better care and really safer and optimized treatment. So just to inform all healthcare professionals, because in my pharmacy degree, which was more than actually 20 years ago, we didn't get any training. We didn't touch on ADHD at all. Now there is a lot more coming through in the last, 5 or 6 years or so. There are more conferences and more seminars which address ADHD, but we didn't get very much at all. So it's all pretty much self-research. And also the reason we decided to do it is when you look at these authors, they're just a small percentage of the amount of knowledge that we have in the membership of AADPA. So we wanted to capture that as well. So the guide itself is primarily aimed at healthcare professionals, but we really wanted to make it as accessible and useful for the experienced prescriber as well as the novice. We wanted to put something in there for pretty much everybody. The guide itself was also written with lived experience collaboration. I myself have ADHD. We have an ADHD lived experience representative, which is Lou Brown. And we also have a few other members who have lived experience. So we really wanted to be true to our experiences and result in positive outcomes for the community. So the guide aims to walk the clinician through the prescribing process. So starting from the point of diagnosis. It's not to replace clinical judgment, but rather to just really complement it. Now, getting back to the previous speaker and many of the speakers during this conference, we also would like to point out that the treatment of ADHD is multimodal. The medications are important, but so are the non-pharmacological strategies, which you would have learned so much about during this conference. So the medications will reduce the core symptoms of ADHD, but we also need non-medical strategies to work together. In fact, there is that saying, pills don't teach skills. In this case, it is very, very true. They do make things better and help implement the strategies, but the two definitely work together. Now, the other point about the guide is that it will be regularly updated. We are setting up a panel with both national and international experts who will then contribute to further updates, because in anything in science, the new evidence is always coming up. So we want to stay current. Now, the other point of who is the contributors. So I've got there on the slide the people who contributed to this writing. They all very generously donated their time and expertise over 2 years to make this happen. So we've got psychiatrists, pediatricians, specialist GPs, psychologists, pharmacists, academia, and also lived experience. And they all brought something unique to the guide. Now, as Dave quite often says, ADHD is easy to treat, but hard to treat well. It's really great to have so much experience to put together into this resource. Now, what does the guide contain? So I'll give you an overview of the information that is contained in this guide. So it's 150 pages and it's divided into two different sections, the patient journey and the frequently asked questions. So sometimes from the point of diagnosis in the patient journey, that can be quite overwhelming, not only for the person with ADHD, but sometimes for a new prescribing clinician. So this guide is a roadmap. It is available for access by anyone on the AADPA website, but its use is intended as a team effort, a collaboration. So any changes to the prescribing process need to be done together with the prescriber. So let me tell you through what the prescribing journey actually is. So it includes starting medication, if that's the path that's decided on. The medication choice, which one to choose first. Titration, how fast, exactly how to do the titration or the upping of the dose process. It covers both stimulant and non-stimulant medication. Monitoring the progress. The whole idea is to optimize the treatment outcomes. So we want to get a dose that is the perfect dose or close to it for everybody. Any precautions, tips about helping with adherence and sticking with the plan, looking at side effects and how we can manage those. There is a bit of pharmacology in terms of how the medications work, and looking also at the pharmacokinetics, and that's how the different dose forms will release the medications and how long that they will be active for. There's information on swapping, increasing, stopping treatment altogether, also using with other medications and in different population groups, and also with other coexisting diagnoses. Together with that, there are also some sample protocols. They are just sample protocols for reference so that someone who is new to the area can just have a look and see what resonates with them. So the second section, that's the frequently asked questions. And these were obtained not only from healthcare professionals, but also from the community itself. So having ADHD myself, I can see on social media what kind of questions come up. And it was really important to try and include some of those answers at least. Now, there are quite a few of these frequently asked questions, but some examples are use in pregnancy or breastfeeding, in other coexisting conditions, medications which contain gluten or lactose, practical advice on which ones can be crushed or dissolved in water or changed to possibly a different dose form. There is a section on sleep, a section on supplements. All of this is very, very heavily evidence-based and reference. So we were really looking at completely putting, along with the guideline, information that has evidence backing it. There's more in there. There's iron status, for example. There's a whole section on pharmacists that I did in terms of some of the things that I do, which is because some of the medications available in Australia have a 6-month prescription expiry date. I always put that date on the actual label because I've missed it before, and it's quite common to run out and not realize that the prescription is expired. There's also information there about using with over-the-counter products, a section on jobs, travel, and substance use disorder, and just so much more. So as I said, all of that is very heavily referenced. So it's designed to be a practical and user-friendly guide, and the aim of that is to increase the patient outcomes. Now, in addition to those two sections, there are also reference tables in there. There's a summary of all of the medications available in Australia for ADHD. There are tables on pregnancy, breastfeeding, side effects, and more. And there are also practice points. And we had, from the contributors, things that have worked in practice for them. So they have included some of those points in the guide. There are also lived experience perspectives. And actually, these are one of my favorite things in that guide, and they really bridge the gap between expectation and real world experience. They really add context for both the prescriber and the person with ADHD, so that the focus can be on the whole person and be realistic and sustainable and something that is individualized. Now, this is my last slide, but I'll just keep talking because I want to give you those take-home messages. So AADPA has also additional resources available on the website, and we're still working to produce more. A lot of the work that we do is voluntary, so we try and get as much done with the time that we have and then the resources that we can allocate to that. So we have quite a few fact sheets available, and there's more coming. So these will all be freely available on that website. We have, with the prescribing guide, there is a cost for it, and that's just the cost recovery to produce it and get it printed and make it available online. So we have applied for government funding, for federal funding, but we're still waiting to see whether some money will come our way, because ideally we would like to make it available as widely as possible. So what I might do is just give some of the takeaways from doing the guide. I actually learned an incredible amount. So when Dave says that it's hard to treat, but easy to treat, but hard to treat well, I get that now. So some of the takeaways for prescribers would be to not stop at the first dose that shows to be working, to take the time to get the dose right, and to also encourage those other complementary strategies. And also to pay particular attention to the release rates of different preparations, so that the person can get a cover of treatment for as long as they need, whether that be short or would that be an entire day. And also those release rates can help with changing from one to the other. Now, for people with ADHD like myself, I think we have to realize that medication will not address all of our ADHD challenges. It will reduce the symptoms, and it's part of the complete treatment plan. So setting realistic expectations is also important. So for example, they will increase focus, but you get to decide what to focus on. So the medication is usually the start of a journey. There may be quite a few emotions that come up at the point of diagnosis and starting those medications. There's an increase in self-awareness and, thoughts about what life could have been like or how things could have been different. Can get anxiety as a result, or the anxiety can go. And it's also important to decide what is a side effect of the actual medication or the process of this life-changing experience that, a change in cognitive function brings about. So, I mean, I don't know about you, but when I started, I was happy with any improvement. So the whole point of this is to optimize treatment to see how good it can get, because it can get a lot better. It can be a lot more nuanced. And also, it's around messaging to children. You know, we're not giving them medication because there's something wrong with them or they're bad. We're giving them medication so that they can be their best selves. And I think empowering them to be able to eventually manage their own medication needs and see in terms of feedback how it affects them is really, really important. The other thing I really learned was that sometimes you may feel like your medication is not working, or it works in a different way. And one of the contributors made a really good point, saying that medications are actually the constant thing. So when you get the dose right, that medication doesn't really change, but life changes. You can still have bad days and good days. So just to look at what else is happening, looking at the quality of sleep, for example, or the amount of stress you're having in the day, or hormones, for example. It all plays a part. And also that medications will change with time. Like for children, they may need increasing doses as they grow up, which will then level up with different stages of life, and they may need different amounts of medication or different regimens, different parts of the menstrual cycle, for example, as well. There is a little bit of discussion about having days off. For children, that can be quite important if they are losing weight, if they're using stimulants. And for adults, it's more to see whether what life is without them. I actually do this myself quite a bit because I just want to see why I need the medication, and sometimes not taking them for a day or two really tells you what their benefit is. So always staying in charge of your own treatment. There was a practice point in there as well about changing doses, especially for children over the weekend, so that the family can see what the effect of the medication, what effect of the changed medication is. There may also be a little bit of nausea when medications are changed or started. So over the weekend is also a good time to try and work out the foods that will work. In fact, in the whole guide, there's quite a lot of information about food, and that's one of the lived experience sections. It offers really good advice about low volume, calorie-rich foods, and so forth. So where do we want to work going forward? So really, we're hoping for some change. We want this to be the start of unified national prescribing standards and more consistency in prescribing and care. So we want it to result in high quality and reliable care. So from then, we're hoping that more prescribers will get interested in their area, feel supported, and that will then improve access regardless of location. So ultimately, safer prescribing. So that's the end of my presentation. Thank you so much for having me. And I really hope that this guide makes a really big impact on the ADHD community. Thank you.
Kate, thank you so much for that. It is an extraordinary amount of work that AADPA's done for those guides. You must be very proud.
I sometimes thought we'd never get there. So I'm really happy that it's finally been released. But it's not over, so I know that.
Yeah, those things, it's a continuum. It keeps on going, doesn't it?
Yes.
For you, I just want to ask you some brief questions. What was some of the key takeaways for you personally about the long-term outcomes and for people with ADHD from the guide?
For me, it was all about getting that dose to be optimal. And just exploring which medication works the best and which dose, and just looking also back on, keeping almost a diary of good days and bad days to see how that can be optimized. It is a team effort in the end with the prescriber. So the more feedback that we can give, the more optimized that dose can be for us. And also learning how we are to use it. I've got two older teenage children, and I think it's really important to also teach them what their needs are, and to be able to, in a way, control their dose or feedback on how it's working, so that they also have, that optimized care.
And that they have agency in that sort of like approach as well, yeah?
Yeah.
We've had a number of speakers that have talked about non-pharmacological approaches as well as that. You obviously think it's important to combine the two. Could you tell me more about that?
Yeah, I think it's crucial. I think just relying on the medication, it will help with some executive functions, but it's putting strategies into place that's going to make it gel and work together. So when you start taking the medication, it starts working, things will start to make sense a little bit, and those processes do start to get easier. So they do work in a complementary way. And that also includes, meditation, as we've had from the previous speaker, and food and exercise, and just all those things that sometimes can be quite overwhelming before treatment. So just trying to get strategies in place to make the two really work well together.
Yeah, in the guide, you've got some misconceptions about ADHD, some of the more popular ones. Can you share some of those with us?
Yep. So we do tackle in the guide things like, long-term use and safety of medications. So there are very good studies showing that these medications are safe long-term. In fact, the most recent study showed that the risk of accidental injury is reduced, and the risk of substance seeking is also reduced, whereas normal cause mortality is not affected. So we want to allay some of that fear associated with medication, as long as it's prescribed, under the care of a physician that knows what they're doing, and all the right monitoring is also done, such as blood pressure and, looking at cardiac history and looking at side effects. And the other misconception really is that, just starting medication is going to fix everything, because we know it's not. It's just the first step.
This last question I've got for you is particularly interesting to me, because it's been a source of debate in our own household. For anyone considering alternatives to daily medication use, what considerations should they have regarding stimulant-free days?
So, sorry, are you asking about alternative medications, or?
No, days when you don't have medication.
Yep. So days when you don't have medication, that for me, it really depends on what your demands are of that day. Yeah. If, for example, some people will only take medication during the working week and not need to take it on the weekends. It really is very individualized, whether for an adult it helps with your driving, whether you need to fulfill certain obligations, whether you want to express your artistic side and just let things flow a little bit more, then you would choose to possibly not. It is very individual, I find. So yeah, that would be down to the individual person, and just learning it's almost like, for me, like wearing a pair of glasses. If I don't need to read something, then I may not need to wear them for that particular time.
Yeah, perfect. Thank you. Thank you so much for your time and your valuable contribution.
Thank you.
Thanks, Kate.